Hi, this is Nitha. Welcome to my channel. Today's discussion is about pharmacology. Let's discuss some of the important questions in pharmacology. It will be useful for examinations in nursing. Let's see the first question. That is about the following is a pro-drug. Options are option A, penicillin, B, levodopa, C, insulin, D, chlorthalidone. What is the correct answer? Correct answer is levodopa. Levodopa is a pro-drug and it is very useful for Parkinsonism. It has antiparkinsonian effect. It is a dopamine precursor. Parkinsonism is characterized by deficiency of the dopamine. So this drug meets or increases availability of the dopamine in body and it crosses blood-brain barrier. Pyridoxine means it is vitamin B6 that enhances peripheral decarboxylation of levodopa. While taking levodopa-carbidopa combination, pyridoxine that decreases the effect of levodopa. Okay. Then we have to take precaution while giving phenothiazine and metoclopramide with levodopa because these are dopamine antagonists. Phenothiazine and metoclopramide are dopamine antagonists that reverse the effect of levodopa. We can see the second question. The Poison Act was passed in. Options are option A, 1878, B, 1919, C, 1930, D, 1940. Correct answer is option B, 1919. The Poison Act was passed in 1919. Question number 3. The Dangerous Drug Act prohibits. Options are option A, manufacture of opium product, B, cultivation of opium product, option C, sale of opium product, D, all of the above. Okay, the correct answer is option D, all of the above. The Dangerous Drug Act that prohibit manufacture, cultivation and sale of opium product. Okay, then we can discuss now few points about Drug Act. Poison Act 1919 that regulate the import, possession and sale of poison. The Dangerous Drug Act 1930 that prohibit cultivation, collection of opium plant, manufacture of opium product, sale of opium drug. Opium drugs means narcotics, morphine-like drugs, morphine, pethidine-like drugs. Okay. And then Opium Act 1878, Pharmacy Act there is 1948, Narcotic Drugs and Psychotropic Substance Act 1985, Drugs Order or Price Control Act 1995. These are the important acts in pharmacology. Let's see the next question. Question number 4. All these are disease-modifying agents used in rheumatoid arthritis. See the option. Option A, aspirin, gold, methotrexate. B, gold, chloroquine, cyclophosphamide. C, ibuprofen, methotrexate, sulfasalazine. D, prednisolone, paracetamol, indomethacin. These are the options. The correct answer is option B, gold, chloroquine, cyclophosphamide. We can discuss few points about rheumatoid arthritis. Yes. Why we selected this answer? Actually, the drugs used in the treatment of rheumatoid arthritis that is divided into or grouped into two categories, NSAIDs and DMARDs. Okay. Rheumatoid arthritis means it's a chronic progressive autoimmune inflammatory disease affecting the joints and periarticular tissue. Joint pain is a main problem. And for this disease, we are using NSAIDs that include aspirin, ibuprofen, etc. DMARDs means this is a group of drugs. Its expansion is disease-modifying anti-rheumatic drugs. That include some of the drugs we can see. What are the drugs included in DMARDs? It means these group of drugs capable of arresting the progress of the disease and inducing remission. That include immunosuppressants. Examples, methotrexate, cyclophosphamide, azathioprine, etc. That include biological agents like infliximab, then rituximab, etc. Gold salt. It was previously used, very effective previously, but now that is not preferred one because of toxicity and availability problem. Other drugs in the DMARDS group, it is chloroquine, D-penicillamine, glucocorticoid and sulfasalazine. So that's brief about what are the medicines included in disease-modifying anti-rheumatic drugs. Let's see the next question. Question number 5. Morphine is contraindicated in head injury because it causes. Options are option A, increase intracranial tension, B, respiratory depression, C, vomiting, meiosis, mental clouding, D, all of the above. What is the correct option? Option D, all of the above is the correct option. It causes increased intracranial tension, respiratory depression, vomiting, meiosis and mental clouding. All answers are correct. We can see few points about morphine. Morphine means it is an analgesic. What type of analgesic? It is an opioid. It is an opioid. Analgesics that is classified into two. One is opioid, another is linacid. Linacid means non-steroidal anti-inflammatory drugs. That is non-opioid. Linacid is non-opioid. Analgesics, one of the important opioid analgesic is morphine. It causes analgesia by raising the pain threshold. In the respiration, it causes respiratory depression. In the cough center, it depresses the cough center, suppresses the cough. That's why it is used as antitussives in dry cough. Pupil, it causes pinpoint pupil in high dose. Due to stimulation of the nucleus of third cranial nerve, it causes pinpoint pupil. That's why it produces meiosis. In the stomach and intestine, it decreases the secretions. It causes constipation. It causes spasm or sphincter of body. It can be dangerous in asthmatics. Why? Because it causes bronchoconstriction. It inhibits urinary voiding reflex. It causes urinary retention. Its specific antidote, it is Naloxone. It is useful in acute morphine poisoning. This is brief about morphine. It's an opioid analgesic. Next question, question number 6. Methadone is used in the management of morphine addiction because morphine is an addictive drug. It causes addiction. Methadone is used in the management of morphine addiction because options are it is orally effective and longer acting. Options B, faster and short acting. C, blocks opioid receptors. D, it causes euphoria. What is the answer? Option E, it is orally effective and longer acting. Few points about methadone. Methadone is a synthetic opioid. So morphine, it's a natural opioid. Methadone is a synthetic opioid. It is orally effective and longer acting. Its T-half, it is between 24 to 36 hours. It is effective orally and long-acting one, and it is more potent and prevent withdrawal symptoms. We can use it for addiction, useful for substituting morphine. In case of addiction, we can substitute morphine with methadone. Okay. Next question. Question number 7. Vomiting should not be induced in treatment of. Options are option A, poisoning with corrosives. B, warfarin poisoning. C, atropine poisoning. D, paracetamol poisoning. It's very easy. Option A, poisoning with corrosives. Because it aggravates the problem. It aggravates the burns. Okay. Question number 8. The antidote in morphine overdose is. Options. Option A, Naloxone. B, Nalbuphine. C, buprenorphine. D, pentazocine. The correct answer it is option A, Naloxone. The best antidote, specific antidote in morphine overdose, it is Naloxone. Next question, you can see the 9th question. The antagonist used in benzodiazepine overdose is. Options are option A, Naloxone. B, fentanyl. C, flumazenil. D, fluoxetine. The correct answer it is flumazenil. That is the antidote of benzodiazepine. So what is benzodiazepine? It causes sedation, hypnosis. It's a group of drugs that cause sedation, hypnosis, reduce anxiety. It relaxes the muscles. It is very useful as anticonvulsant agent. Examples: diazepam, clonazepam, alprazolam, midazolam, etc. are the examples of benzodiazepine. Its antagonist is flumazenil. Okay. The last question, the 10th question, that is regarding arsenic poisoning. The drug of choice in arsenic poisoning is. Options are: option A, dimercaprol, B, D-penicillamine, C, desferrioxamine, D, N-acetylcysteine. The answer is option A, dimercaprol. That is the correct answer. So, few points about antidote. What is antidote? It antagonizes and overcomes the effect of a poison or effect of an overdose of a medicine. Some of the examples we can see: copper poisoning, copper overdose. What is antidote? D-penicillamine. Iron, desferrioxamine. Lead, calcium disodium erythritate. Paracetamol, N-acetylcysteine. Cyanide, sodium sulfate and sodium thiosulfate. Warfarin, vitamin K, fresh blood. Streptokinase, epsilon aminocaproic acid. Atropine, physostigmine. Theophylline, caffeine. Its antidote is esmolol. Organophosphate, atropine and pralidoxin. These are some of the examples of antidote. Okay, I think we got few concepts about what pharmacology and its important questions. If it is useful for you, please like, share and subscribe. Thank you.